Okay, so, does that make sense for everybody? Pretty simple and easy to do. However, I know in the mornings when you're like, oh my god, I got 12 people to get up that I need to get to breakfast, so what am I going to do? And you're like, grab your toothpaste. It's going to take a lot of patience. However, in the end, it's very beneficial. So absolutely practice this on your own, help each other out, and absolutely we want to see this at meals, especially at meals. So now we're going to get into talking about communication. This module is about building relationships in community. All these approaches that we're going to go over obviously does that. That builds that connection piece. But really, we need to always focus on communication. When we go to buildings, communication is the one thing that everyone needs to work on. It's just constant. So when we're working with individuals with dementia, we really want to make sure that we're clear and concise on our communication. So individuals with dementia may try to communicate to us, however they have difficulty finding the right words. I might be saying chair, 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 and I really want the apple on the table. Okay? Use familiar words repeatedly. I want to go home. 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 These are all people I'm sure you've taken care of. Okay? Invent new words to describe familiar objects. Just said that one. Easily lose their train of thought. Have difficulty organizing words logically. We've all seen this in every one of our individuals that we've cared for. Unfortunately, what we do with them, however, is a lot of ineffective communication methods. We will go into buildings and we see this stuff nonstop, and it really is going to take you internally to stop yourself from doing it. Brushing would be an example. So here's your toothpaste, here's your toothbrush, brush your hair, brush your teeth. Aren't you going to eat? Let's get dressed. 10 tasks at a time. You really just need to slow down. Even in our speech and communication, we need to have that patience to say, do you want the red shirt or the blue shirt?
The red.
Okay. It wasn't very long until someone answered, but I was going to wait for her to answer. Okay. So you need to have that calm in between our communication as well. Quizzing is something that I see everybody doing. And I actually was at a building yesterday doing this training. They got a little bit confused and they said, you said you can't ask them questions. No, you can ask them questions within the moment. Do you want a red or a blue shirt? Do you like peas or carrots? Those are questions within the moment. What we mean by quizzing is, what'd you eat last night? Okay? Or what'd you do for an activity last night or yesterday or 3 weeks ago? People with dementia are not going to remember that. And it's going to cause a lot of anxiety for them within that moment because they can't remember that. Okay? So you can ask questions within the moment, but the quizzing piece is we don't want to get into what happened 3 weeks ago or even last night because, again, that's going to cause a lot of anxiety for that individual. As we mentioned earlier, showing impatience on your face, body language is read until the very, very end. Even if you have those holes in your brain with dementia, it's definitely going to be something that they grasp. So if you're coming in and saying, this is a great day, I'm not going to believe you because your body language is definitely not showing on your face. You might have your arms crossed. So definitely watch for the body language, facial expressions, and tone of voice to match your communication. So effective communication then, we obviously are going to get into the positive physical approach here in a little bit, and it ties into all of this type of stuff. So we want to identify ourselves. We want to address them by name. We don't use honey, sweetie, or anything like that unless obviously it would be their official nickname that we care plan. Okay. Use short, simple, and familiar words and sentences. We talk slow and clearly. We give one-step directions, and we're going to ask one question at a time, and definitely be patient to wait for the answer. If they don't get it, we are definitely going to repeat it. We're going to turn questions into answers. Avoid literal expressions. What we mean by that is individuals with dementia take everything at face value. So if we say it's raining cats and dogs outside, they're like, it is? Where's the cats? Where's the dogs? My dog's name is Susie. So we definitely need to watch our slang because we, as Americans, have a lot of slang. We need to bring that down. Avoid pronouns. emphasize keywords, make negatives more positive, and pay attention to our body language yet again. Also, too, visual cues are definitely beneficial with communication and providing simple explanations as to why maybe they need to do something. Again, with all of this stuff, you obviously need to understand what level and stage of dementia they're at, and utilize the techniques appropriately. Writing things down might be appropriate, trying again later, and always be respectful and honor their dignity throughout communication. So, the positive physical approaches utilizes all of those things that we mentioned there. And you guys learned this in your CARES training, so how many of you have implemented or done the positive physical approach? Anyone? Okay. It's not a surprise to us that none of you have. We understand that the CARES training was, it's a good training. 4 hours of having you sit in front of a computer. However, may not be the most beneficial education opportunity for you to retain information and actually implement it. So that again is why we're here. You've learned it already, you've seen it, however, now we need to put it into practice. Okay? So I need someone to volunteer to come be my resident. Thank you. Bring a chair around, Jen. Okay, so positive physical approach. A lot of body language involved with this. This will be your approach for your individuals with dementia every single time. Okay? So, if I come in the room, what's your name? Heather? If I come into Heather's room, I'm going to do the positive physical approach. I go and I clean her bathroom, and I turn around and I approach her. I'm going to do the positive physical approach again. Okay? Now, again, you need to understand what stage of dementia these individuals are in. However, I like to say caution on the safe side versus the sorry side. Okay? I would rather be silly and joke with this person that I'm introducing myself again versus them all of a sudden transitioning to a later dementia stage, not knowing who I am and having anxiety over it. Okay? Does that make sense? All right, so the positive physical approach. First of all, whenever you approach somebody, you never want to come at them from the front. Okay? Like, hey, how's it going? All right? I'm obviously establishing power over her. Okay? You do not want to do that. I worked in a foster home with highly behavioral males, and they would always come up and like hover over top of me and try to be like, I'm not doing that. I'm not doing that. And try to tell me to switch my attitude. However, I knew they were doing that, so it didn't work. Little, old, frail, lovely people that we take care of, we definitely don't ever want them to feel in that downward position. So approach from the side, and we're going to get down on our knees. Okay? A lot of people yesterday were like, I have bad knees, I can't do that. Well, pull up a chair then. Okay? Because this is extremely important that she now feels in control of the situation. She is in power over me. Okay? I see a lot of people come up and do this. It's a good attempt, but it's not what we want. Okay, so you really do have to get down on your knees. They got little garden pads and stuff we can get you to. So we're going to come in, come from the side, get down, and then I think the most powerful piece of it is the handshake. Okay? The handshake is going to tell you so much information on how this interaction is going to go. Okay? So I come in. Heather, give me your hand immediately. I know she's going to cooperate with me probably. This is going to be a smooth communication. Things are going to go well. Okay? However, if I offer my hand and she just is like sitting there looking at me with this deer in the headlight, like I don't know you, then I'm going to be like, okay, this is going to be a little tougher. Things aren't going to go as smooth. Okay? So it tells you a lot of information initially. So, offer my hand. I am going to introduce myself and let her name herself. So, hi, I'm Racy. What's your name? Heather. Nice to meet you, Heather. All right. Reason you do this now is because Heather could be a mom. She could be Mrs. Carlson. She could be a teacher. She could be grandma. Okay? You let them decide where they're at in their own world. Okay? 1 minute she might introduce herself as Heather. The next minute I'm cleaning the bathroom. I come back and she's like, oh, I'm Mrs. Carlson. I knew she was a teacher, and therefore that's where she's at in her mentality. Okay? So that's the part where I say better safe than sorry. If I go away, hi, I'm Racy.
Hi, I'm Mrs. Carlson.
Oh, Mrs. Carlson, nice to meet you. Go away, come back. Hey, it's Racy.
Heather.
Oh, Heather. You know, again, that's the time where you can joke around about it. Better safe than sorry than her looking at me like, oh my God, who's this person that thinks they know me in my room? Okay? So, hi, I'm Racy.
Hi, I'm Heather.
Ah, hello, how are you doing? In the conversation, you're going to switch your hand position as well, okay? Some people like to just flip it. I personally like to rotate it. Now, this is again giving her yet more control of the situation. Body language now says she is in power, okay? So you just rest it on her leg or whatever, and then you discuss what you need to have her do or go about your day, or just maybe you're visiting, okay? A lot of people will do this with their other hand. It's a nice term of endearment, however, you are now taking the power away again. So with that other hand, either put it on the chair, put it on your leg, however you need to be comfortable, but try not to put it over top of theirs. Okay? Over on the arm sometimes is okay too. Alright? So that all in all is the positive physical approach. That's what you will utilize with all of your residents. Any questions? Alright, so you guys are going to pair up and practice. Do it standing, sitting, switch roles. Hi, Don. Or wait, no.